Hi, everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing people in private practice from all across the United States. And every week we're coming here, getting a brand new perspective, learning something new. And today we have a really awesome special guest, and I'm very excited to introduce you to Dr. Edgar Chavez. He is the founder and chief medical director of Universal Community Health Center in Los Angeles. Welcome, Dr. Chavez.
Thank you for having me. It's a pleasure to be here.
Yes, we're so excited to chat with you. I know we have a lot to dive into today, but I always like to start off with just getting an overall sense, and I think everyone wants to know who's Dr. Chavez and what is he doing, and so we would love to hear your story and what inspires you to open Universal Community Health Center.
Yeah, absolutely. Thank you for the opportunity to share our story and what we do at our health center. So I grew up in South Central Los Angeles. I'm an immigrant, and going through my own personal experiences in the medical field here in underserved communities. Even at the age of 12, 13, I knew that healthcare could be improved, and so that kind of stuck with me as I grew up. And realized that there's a lot of need for culturally competent, for people that speak the language in underserved communities, because historically we get healthcare that is sometimes not helpful, especially when it comes to preventive health and education.
Sure.
And so, kind of growing up in that environment, I really wanted to change things. So I had this pipe dream. I wanted to have a free clinic. That was my idea going through college, going to medical school, and then finally doing residency program here in East Los Angeles. And then when I came out and I tried to do that, it was really difficult. It was really difficult. I feel for those private providers that want to start their own practice, because it is a huge challenge. The payment is not there. Getting the patients is really difficult. And
Yes.
then as a medical provider, you don't get any training on how to run a clinic, right? How to operate a clinic. And so those were huge challenges. But I was fortunate enough along the way that I got some help from other nonprofits that provided support for me to convert my clinic into a nonprofit community clinic, and then eventually become something so wonderful, a federally qualified healthcare center, which is basically a community clinic that is funded partially by the federal government, which affords us the opportunity to provide care to people regardless of ability to pay.
It's such an admirable thing to do, and it is so hard. Talking about private practices, whether your private practice or rural health center or community center, there's so much that you all the hats that you have to wear and all the things that, hey, I came to do this because I wanted to help people, and then you're burdened with having to run a business, and that is difficult within itself while you're trying to do your best by your patients, by your clients, and to serve an underserved community that need it the most. And so I commend you for starting what you did, because I know it's not an easy road. It's the road less traveled. So,
Yes, absolutely, absolutely. As a family medicine physician, I think it's one of those things where you feel you want to do everything for the community, but a lot of the times, unfortunately, the resources are not there. And sometimes going the nonprofit way is an opportunity that allows you to get some of that funding that you need to provide the care.
absolutely. And in terms of your center in particular, I'd love to hear about, some of the most common areas that you treat or really find people are struggling with today in your community. And maybe there's some uncommon things that you treat or support. I always think there's more than what meets the eye or what people can read online. So I'd love to hear about what you're doing today.
Yeah, so at its base, a community health center is supposed to provide a medical home for people, right? So where you provide everything in one place so that people don't have to travel or don't have to go somewhere else to find it. So at our particular health center, which is common among other health centers across the nation, there's over 1,700 of these centers with over 17,000 clinics. So we're a really huge community of clinics. And so at its base, we offer preventive primary care. So anything from zero all the way out to senior care. We do behavioral health services, dental services, optometry. We do podiatry. We also delve into some of those social determinants of health. People are struggling out there with food insecurity, with housing insecurity, with joblessness. And so a lot of us as health centers try to either attack or alleviate some of those things internally, or we refer out to sister agencies that may be doing that. So in our case, with everything that's going on, we decided that we were going to delve into food insecurity, and so we opened a food pantry. So every a month, the first week of the month, we open the food pantry, from 8 in the morning until 2 in the afternoon, and we distribute food to whoever wants to come, not just our patients. So that's one way that we're doing that. But then there's also other innovative ways, that we're trying to figure out, okay, so how is our community being affected? How are they being challenged? And one of the things that's really interesting that we're trying to get into is a program of tattoo removal. So
Mm.
tattoo removal is one of those things where you often think of, recently incarcerated people or people who are dealing with issues of gang violence, right? That they have these tattoos. And so there is these specialized programs where people go and get these tattoos removed. But in our own community, and we did polling to try to tease this out, in our own community, we have a lot of people that have tattoos that may not be gang related or prison related, that have these behavioral health negative connotations, right? They have this tattoo that they want to get rid of because it brings out bad memories of a relationship or bad memories of a time in their life, right? And a lot of our community doesn't have the means to pay for some of these services, right? Because when you go out there, these are very lucrative industries, right? Where people are getting charged between 2,000 and 3,000. Some people pay $5,000 to get like a 1 by 1 inch tattoo because it takes a long time. Yeah. And so for us, we were like, how can we do this? So we went out, we got a grant, we bought the machine, and we're actually in the process of creating this, what we call community tattoo removal, where anybody can come in, regardless of ability to pay, can come in, get evaluated, and hopefully we can help them. But additionally to that, we hope that the tattoo removal becomes a gateway for primary care, which is something that people don't think about, right? When you're here for tattoo removal, I'm going to check your blood. I'm going to do a blood pressure check, and maybe I'll find diabetics, hypertensives, right? So using tattoo removal for those people who normally wouldn't come to get healthcare to get primary care. So we're really excited about that program.
Interesting. And I'd love to hear a little bit more about your programs. Do you often find with the various ones that you are providing to your community, are you getting folks that, are not seeking services at the moment, but once they meet you, it is kind of that gateway to, hey, yeah, I can help with primary care, or maybe it's, I'm not sure if you do dermatology, but I would love to hear about some of the other programs and services that you're offering, just so other people know. I think what you're doing is incredible in terms of that tattoo removal. I mean, that is something that is unheard of, I would say, in your realm of things. That's
Yes.
not a common offer. So, but it's creative because yes, it has to do with the human side, the behavioral side, the emotion that people are going through. Maybe that, like you said, that have a tattoo that brings a bad memory, and it's hard for them to move on from where they're at currently.
Yeah, earlier I mentioned this concept of a medical home for somebody, right? And for underserved communities, this is a key thing, right? A medical home means that they can get pretty much everything, right? So for us, what we try to do when we approach programs is we look at, okay, we're having an issue with referring patients out for dermatology, for ear, nose, and throat, for podiatry, right? So then what we do is we look at, okay, what can we do as primary care providers? So we come up with primary care bends to some of these things. So for example, we have a physician assistant who, before she came to work with us, she worked with a dermatologist for like 5, 6 years. So she has that experience. So we decided that we were going to create a community-based dermatology program. So we send all of the dermatology primary care that she can handle.
Yeah.
Anything else we send out. Same thing
Sure.
with podiatry. We hired our own podiatrist to see patients at our clinic. Same thing with ear, nose, and throat. I had somebody who trained under an ear, nose, and throat, another mid-level, and so that way you give people the opportunity to create a practice that brings joy to their life, right? Because doing primary care and everyday diabetics and hypertension is not for everybody. It will burn people out. And so here at our health center, we try to evaluate, right, what providers are interested in, and then leverage that into creating these programs that eventually will lessen that burden for sending people out into, places that we don't know.
Yeah, it's amazing because yes, I mean a lot of, places have also a very long wait to see specialists as well. And it's so great that you've hired people that have that industry experience, that are specialists that can see these people and that can get them, at least the first step to help. And if you can help someone and they can be on their merry way, then great. And yes, if you have to refer out because it's something beyond of what you can do. I think that's so great that you can at least address their immediate concern. And I think that's the most important is the access. And that's what you're providing is access to people. And something that I've been curious about. And I think, every I would say specialty or corner of healthcare has its own misconceptions about things. I think people think things about rural health, community health, private practice, specialties. I think we're all plagued with them, and I'd love to hear from your standpoint. What are maybe some of the misconceptions about community clinics? And maybe there's something that you can help us debunk today and once and for all, you need people to know this.
As I mentioned earlier, community clinics are everywhere. I mean,
Yeah.
across the nation, there's over 17,000 clinics that are community clinics, right? So there's one somewhere near you, right? And the misconception that people have is that some of these community clinics are only for the poor, right? They're only for the people who are disadvantaged. They're only for and another misconception is sometimes you feel like, man, I'm going to this free clinic. They're not going to provide quality care, right? That's totally the opposite. I mean, community clinics are a place for the community, whoever is there, right? So, for example, for us, we take Medicaid, Medicare, we take commercial insurance, we take uninsured. So, pretty much anybody in the community can come. And one of the things that, community clinics pride themselves on is that we are under evaluation by the federal government. So we have to meet certain standards, right, of quality. And so we all get badges every year in terms of like doing colorectal cancer screening, breast exams, or mammograms, things like that. And so we are a quality driven movement. And so people should understand that these are high quality access points where our focus is primary care, right? Is holistic approach to the person. And so whenever you see a clinic, a community clinic, you shouldn't be afraid to make that your medical home, right? Because the more people come to see us, the more support we get. Because in fact, we take care of 1 of every 10 Americans, okay, in the whole United States. So I think that that's a testament of how big we are and how resilient and how much needed we are in every community.
That's amazing. I'm curious, and maybe you have the answer to this, but why is it such that, you did talk about some of the big misconception there that, community clinics are for folks that that may not have the funds, underserved areas. But you're right, it's in the name, it is for the community. And why do you think it is branded as such? I think you have such a great messaging, and this is exactly why we do Provider Spotlight. We want the truth to get out here. We want people to come with all different perspectives and share their knowledge, and because we're all better for in the end. And I think we often we write things off too soon as a population. you know
Yeah, no, absolutely. And I think a lot of the misconceptions come from this idea that community clinics are like a free clinic, like a pop-up clinic that only shows up once, that is mostly staffed by volunteer physicians or volunteer staff, that there's no continuity, right?
Mhm.
But I think that's so far from the reality of what a federally qualified community clinic is. We get funding from the federal government to serve the community, right? And then we also get enhanced reimbursement so that we could do whole person care. And so I think that that should give you that confidence, right? That the medical provider that is at these health centers can provide you, the best quality of care that, even a private physician or a private medical provider would give you.
Yeah, and you have made and it so many strides to not only provide for your community, but get the right people in place, the right programs in place, the right technology in place. You talking about the tattoo removal machine. There's all these things. So you've clearly built a strong community, and I think it'd be interesting for people to know, especially providers. How maybe some pro tips on, what technology is really helpful to you, and how are you using it to support your patients, your clinicians, and maybe even talking about, dare I say, AI. I know there's a lot of controversy around it, but I think, you've made some pretty big leaps and you serve a very large community, and I'd love to hear about how that's serving you today, and maybe just sharing with the folks out here how they could adopt that into their own practices.
Yeah, that's you're hitting one of my passions. I could talk
Oh,
hours on technology and AI, but from the inception of Universal Community Health Center, I was always a techie guy. Before I went to medical school, I was actually a computer repair person. Okay, so I geek out on computers and technology. But when I started Universal Community Health Center, one of the first things that I did was get an electronic medical record. Because when I got into the practice, there was like thousands and thousands of charts, paper, right? And I used to tell people I am allergic to paper. Okay, I do not want to see charts, right? And so I think that for the most part, most people are already using an electronic medical record. If you're not, please, there's so many options out there. Please look at getting yourself an electronic medical record. But in terms of the advancement of technology in medicine, right? I know that there's a lot of people that are scared of artificial intelligence and something that we call automation, right? But
yeah,
I think that that is the wrong approach. I think that we need to be open to the technology because as a family medicine physician, right, that sees patients, I feel like there has been a huge burden placed on us, right, in
yeah,
terms of what we need to deliver in a timely fashion, right? So we're given 10 minutes, 15 minutes, 30 minutes, right? To see a patient, diagnose, do all these different things. And then after you're done with that patient, we also have some desktop medicine for you, right? You need to review labs, documents, refill prescriptions.
mhm,
There isn't enough time in a day
yeah,
as a full-time medical provider to do all of that stuff, right? And so I think that this is where you need to start considering, okay, are there other options out there that are going to help me? Because one of the things that I think we have lost in this lofty goal of doing quality, right? And
mhm,
when people tell you you got to do quality, it comes a touch with a lot of paperwork, a lot of things that are coming externally to you that you need to review in order to provide that quality, or even report that quality, right? There's a lot that you need to do to that. So I think that one of the areas that people should start looking into is something called ambient listening, okay, for you to do dictation. Because right now, what you have is either people are typing away like feverishly, right, trying to get that information, or they're using some kind of a human scribe, right, that's listening to the conversation and then they're typing in for you, right? Um, but technology has advanced so much, right, that now they have AI enhanced ambient listening, where some EHRs even have a button that you just press and it
yep,
starts recording for you, right? And then it does a transcription. And that
yeah,
transcription is way better than what you would ever type or even a scribe would type. And it makes the visit more of an engaged encounter, right? Because uh, I don't know if you've been to the doctor lately, but when you go, you either have a doctor behind a computer or behind a tablet, and you're talking to them, they won't even make contact with you. They're just typing away, trying to get all that information in there, right? Or they're scrolling, trying to find information, right? Which is very disruptive for that patient provider interaction, right? So I think that you need to look at the at ambient listening, and that's your gateway into getting into the realm of augmentation, of AI, of
Yeah.
automation, because there's so many other things that I could go into, but I think that that's the one that's catching on right now. I know people are concerned about it, but I think that concern should not be what's leaving you behind. You need to delve into it.
I could not agree more. And, I think it's not something to be afraid of. It's not here to, completely replace, but it is to enhance and it is to help you be more efficient. And, there is so many things that you have to do in a given day, and you simply can't do them all. And if you had something to help assist you, make it easier, faster, better for you and your patient. Now, I'm curious to hear, you've definitely talked about, utilizing it from the provider side of things, but I'd love to hear about patient adoption. I think, that can, for anyone to try new things, sometimes there's always hesitation and
Yeah.
um, anticipation of using something new that they're not familiar with. But how have you had, or to your knowledge, patients more easily adopting the utilization of AI, or other streamlining methods to better help the both of you blend worlds, so to say?
Absolutely. I think that that's a great question, right? Because I am only half of the equation, right? You
Yeah,
have to think about the patient. And so it's all in the way that you frame it, okay? Because when I started implementing ambient listening to be my transcription service, my recording transcription service, I would explain it to the patient the following way. Hey, I am using AI technology to capture everything that you're telling me and to capture everything that I'm telling you so that later on I can read it and I can actually, if I didn't catch or if I didn't pay attention specifically to something you said right now, I'm going to do it later, right? So patients are like, oh my God, that's wonderful. Nothing is going to be left. Because when you're in a 10, 15-minute visit, sometimes you have to cut off the patient, right? Or not get the whole story, or in your anxiety to get everything that you think is important into the chart, you will forget other things, and then you also need to move on to the next patient, right? So uh, getting the patient to understand that this is for their benefit, I think it's key, right? What we did at our practice is we did an opt-out option, right? So that means that I'm sorry, an opt-in option where everybody's opt-in by default, and when
sure.
they sign a consent in the front, it says, this practice is using ambient listening and AI to
Yeah.
help with your visit, right?
Mhm.
If you have questions or if you have concerns or if you would like to opt out, then go ahead and let us know. And so by default, everybody is in. And so over the last year or so that I've been using this, people, the patients are now reminding me, are you turning on the ambient listening? Because I would like it to get everything that I'm saying, right?
Oh, that's so smart.
Yeah, yeah, and so they have buy-in. The other one that's interesting, we have some automation where we send texts regularly to remind people, right? So we don't even use humans to do that
Yeah.
anymore. And now patients will come in and they will complain and say, you know what? I was supposed to get a text 7 days ago, and then again in 2 days to remind me about my appointment. Like, what happened, right? So something, there was a glitch or whatever. So now patients are getting used to that expectation, right? That there is AI, that there is automation being used in order to get them to come to their visits. So I think that it is going to be a culture change, a
Yeah.
shift in the way that people realize, you know what? I understand that my health center just doesn't have enough manpower to do this. They have to use automation. And I think the adoption has been pretty good.
You brought up two really interesting points there, which I love. I didn't think that people would be so excited to receive their charting notes, but it's true. Sometimes as a patient, you walk in and you come out and you say, okay, what just happened there? I'm
Mhm.
confused.
Yep.
And that can just happen. You're fast paced, maybe a lot to think about, maybe you got a recent diagnosis, and
Yep.
so it's great to be able to have those notes and know the next step afterwards. And that is a benefit to utilizing AI. And I wouldn't think about that from the patient side of things, but yes, that is a really great point that you make. And it's funny to hear that people are asking, did you turn it on? I want these.
Yeah.
So I think that's fantastic. But also to your point too, not everyone is as organized, or let's say, something they had a calendar snafu and oh my gosh, thank God this text message came through. I forgot I had scheduled this. I didn't put it in my appointment book, calendar, whatever it might be. And now I have the opportunity to come because someone else reminded me. And so I think that's a great use of automation that is beneficial, clearly beneficial to both parties. And so I think maybe it's more about how you're educating, like you have the patient on, what you're using and why, and giving them the ability to opt in automatically. So I think that's great. But in term to wrap everything up today, I've really enjoyed chatting with you, Dr. Chavez, and something that we always like to do, if people would like to reach out or just get more resources, you guys are offering so many different things. There's always more than what meets the eye. So if you could tell everyone, where they can find you, grab some resources, and or learn about more about your programs, that would be great.
Yeah, absolutely. As I mentioned, every state has a community clinic that you can look up, right? And there's websites and her site. Just all you have to do in Google is community clinic in my area, and it will take you to a finder to do that. But if you are in California, we are Universal Community Health Center. And you can find us. I'll just give you the website, www.uchcla.org, and it has all of our information there. We have 6 locations to serve the underserved community here in South Los Angeles, and we welcome anybody.
Well, I love hearing that. And like Dr. Chavez says, definitely reach out if you're in the area or not. Do your homework and definitely Google community centers are for your community. I think that's a good way to leave off, right?
Yes, absolutely.
Well, it was awesome having you, and we hope to have you again, Dr. Chavez.
Thank you for the opportunity.
Thank you.